Hi, I'm Dr. Mayank. I'm a board certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery. I have been doing hair restoration practice for the past 12 years in New Delhi. Today we are going to talk about the relevance and the importance of hairline design. Hairline is basically the part which gives you the definition to your face. If we feel that a hairline is looking too low or too high, or the angles, directions, arrangement of hair is unnatural, in that case it is identifiable that it is a badly done hair transplant. Suppose we go in for a hair transplant where we have abnormally implanted hair follicles, where people can identify from a distance itself that it has been something done on the scalp which is looking weird. In that case, it's supposedly a failure of a procedure. When we talk about hair transplant, hairline designing, the first aspect comes in terms of placement of the level of that hairline. The level of the hairline is going to be something which has to be calculated as per the patient's age, what is the grade of baldness that he has today, what is the level of baldness that he may proceed to depending upon the hereditary factors which run in the family. So if we have a grade 6 or 7 running in the family and someone at 24-25 years of age comes with a grade 3 or 4 and we create a hairline which is very low or flat, it would always seem to be unnatural as we age over a period of time. Additionally, if advanced grades of baldness run in the family and someone is getting a low hairline created, in that case, the recipient area which is going to be required to be covered over the entire life is going to be extensive. Similarly, if we make a conservative hairline for someone at this kind of an age with a history of advanced baldness, in that case, we would have a defined small area to be covered relatively, which can be covered over a period of time with much better density and arrangement of follicles. The design of the hairline would be subject to what is the kind of a race that a person is coming from. A person who's coming from an African American background would have a relatively straight and flat hairline. A male of an Asian race would have a relatively conservative hairline which would recede toward the sides. As we go towards a Caucasian race, in that case you would have a much more receded frontotemporal junction onto the sides in relevance to what Asians have. So depending upon all these and the kind of aesthetics of the face, we would place the arrangement of the design of hairline on individuals. Hairline designing is something which is basically a part of an art. If we place the hairline at the right level, give the right correct angles, directions, arrangement of hair, irregularities, the macro and micro mounts, and give a good natural arrangement, in that case, hairline would be something which would give you the 5 stars of a good hair transplant. If a hairline is created in a manner with a linearity which looks very dense and multiple follicles are placed right in the front instead of the single irregular follicle arrangement which is important, in that case the hairline would always look unnatural. I'm going to show you some cases where pathetically done hairlines have come to us, where you would be in a position to identify that multiple follicles have been implanted, the transition of the frontotemporal junctions recession has not been given, and you would be in a position to make out that it is something which is done poorly. Come, let's have a look at that. So we are talking about a 26 years old gentleman who had undergone a hair transplant as an FUE procedure with one of the clinics where the technicians performed his procedure. As we can see, this is just the kind of implantation that has been done, and he has had further progression of hair loss beyond the zone. Let's talk about the kind of hairline and arrangement what he has been given. If we look at his hairline, this hairline is going absolutely linear with multiple follicles placed right in the hairline itself. There is no transition which is going as a frontotemporal junction which gives a natural looking appearance to an individual. So if you look at this marking, this is the kind of hairline that the person should be having for it to make the look absolutely natural. Similarly, on the other side, you can see some amount of pitting, and there are multiple follicles which have been implanted for the gentleman, and again the linearity of the hairline is going in the same manner as it was on the other side. So for the other side itself, we have, for the right side, we have again created a natural looking hairline marking, and all these follicles that have been placed ahead of it as multiples were punched out with FUE technique. So if you look at the day of implantation, all the part which I was mentioning about has been extracted, only leaving behind the single hair follicles which have been placed, which gives a natural transition of the frontotemporal junctions on both the sides. This is the appearance of the gentleman at 5 months after the procedure, where we have just implanted 3300 follicles. So when we have given this kind of arrangement, you can look at the hairline has been rectified. You would see that the softened hairline has been given from where it was. All the multiple follicles have been punched out. Obviously, we could not rectify the kind of cobblestoning and pitting that the gentleman had from the previous surgery, but rest, the transition has been given on both the sides. This is the top view of the same individual. Now, if you look at the coverage, whatever was the further progression of the baldness in this area has been covered, and even the thinning parts have improved with the medications. So look at from where we look at an unnatural looking hairline to a natural looking hairline, and that would explain what is the kind of impact that a hairline can have for an individual. So in summary, now each one of you must be aware what a good looking natural hairline can create as an impact in a hair transplantation. I would encourage each one of you to always consult a professional hair transplant surgeon who is properly qualified and experienced to judge what exactly should be the placement of the hairline, what should be the design, and what should be the arrangement given for every individual. I would like to thank you for giving us your precious time, and would really appreciate if you could like and share the video for the awareness of everyone who's planning to undergo a hair transplantation. If you have any further queries or concerns, please contact on the number given below. Thank you.